Thank you very much, and I know you're all looking at your watches. That won't make any difference. I'll still talk too long. That's the way senators behave. I want to take a line out of Matt Miller's presentation where he's going to tell you a story and then give you a few comments afterwards. And the story is not mine. It's Secretary Leavitt's, the Secretary of Health and Human Services. And his health care is a health savings account. He made that conscious decision. When he reached the appropriate age where people said to him, it's appropriate, it's almost essential that you have a colonoscopy, and his wife is the same age, he decided, okay, we're both going to have a colonoscopy, and I'm going to pay for it out of the health savings account because the health savings account just has catastrophic insurance, and it's the savings money that we go for this. So he went to a hospital in Washington and said, I want to have a colonoscopy. How much is it going to cost? We don't know. He said, what do you mean you don't know? They said, we've never priced a colonoscopy before. We have no idea what a colonoscopy costs. Well, Secretary Leavitt used to be an insurance salesman. He pulls out a piece of paper. He says, let's do a bid sheet here. What is going to go into this? Well, you know, this kind of anesthesia is this much, and this kind is that much, and this much is this, so on, and if you do it this, that, so on. He forced them to go through the process of pricing a colonoscopy, and when he got through, they said, $6,000. And he said, $6,000? That's $12,000 out of my health savings account. I had absolutely no idea. I'm going to go get a competitive bid. Well, you're not supposed to do that. You're supposed to listen to the doctor who tells you what's best for you. So he goes to another hospital. How much colonoscopy? We don't know. Yes, you do. Here's the bid sheet. Let's go through it. 1, 2, 3, the whole thing. $5,000. All right, now he's faced with a fundamental question. Is a $5,000 colonoscopy less good than a $6,000 colonoscopy? A $5,000 used car is presumably not as good as a $6,000 bid. What about this? Then finally somebody said to him, why don't you price it in Utah? He used to be the governor of Utah. He goes to Utah. I made this point earlier. The Dartmouth study says if you want the best health care you can get anywhere in the country, that means probably the world, you go to one of 3 cities: Seattle, Washington, Rochester, Minnesota, and Salt Lake City, Utah. So he goes to Salt Lake City, Utah, that has the reputation of having the best, and says, how much for a colonoscopy? And they tell him $3,000. That's why we've got problems in health care, because the market isn't working. Market forces say the guy who's charging $6,000 better get on the ball and start charging $3,000 or he's going to lose customers. Furthermore, transparency says he better be able to demonstrate that his $6,000 now $3,000 colonoscopy is just as good as the one that's $3,000 or he's still going to lose customers. The fundamental moment of truth between Ron and me when we came together is when he recognized that I, as a conservative Republican, was willing to face the obvious fact that we need universal coverage in this country. And I'm even willing to use the phrase. All of the political consultants that advise Republicans say we should say every American insured rather than universal coverage, because universal coverage is code for single-payer government-run system, and we're against that. I'm still against that, but I'm willing to say everybody ought to be covered, and if you want to call that universal coverage, I can live with it. Why? Because we've got it now. People walk into an emergency room, they get whatever they get, they say, I have no coverage, they walk out, everybody else pays for it. We have de facto universal coverage. It's simply the most expensive, least effective, most objectionable way of delivering it let's get over that and say, let's make universal coverage make sense. So I'm willing to come there. The thing that he's willing to do, in recognition of the Levitt colonoscopy example, say, let's get market forces working in this system. And that alone, you talked about competition, that's the way you get competition. You get it through transparency, and you get it through control of the dollars. If this is 16 to 17% of GDP, it's the only portion of GDP where the person receiving the goods or services does not control the dollars paying for the goods and services. That's the big problem with the employer-based system, and it is cemented into our lives by virtue of the tax laws. And when Ron said, I want to change the tax laws to make it possible for the individuals to control their own money, I said, sign me up. So the Democrat came to the table believing in markets, which is supposed to be a Republican monopoly. And the Republican comes to the table believing in universal coverage, which is supposed to be a Democratic monopoly, and we had the basis of here's where we're going to go. Now, to the employers, Matt's point, employers say, I want to use this as a recruitment and retention tool. I've been a CEO. I say, fine, you can use it as a recruitment and a retention tool. We'll keep that. But choice remains. The dollars that are in that system for your employee are under the control of your employee. And if he wants to take those dollars and leave your system and go down the road someplace else, he can do it, which means you'd better be darn sure your system is competitive. You'd better be sure your system is a true recruitment and replacement tool instead of a pair of handcuffs that keeps people working for you that shouldn't. Ron has his questions that he asks in his town meetings. The one question I ask, and I always get hands raised, usually a majority, I say, how many of you know or are someone trapped in a job you hate because you are afraid you're going to lose your health care benefits? Should we try it here? How many of you know somebody or are trapped in a job you hate because of this? All right, we all know somebody like that. Once you put the dollars that are being spent for the system in the hands of the person who's going to get the benefit, then you get the demand for transparency, you get demand for comparison, you get the demand for competitive innovation, and insurance companies will start to create the kinds of products that will attract the Michael Levitts of this world to come to their doorstep. See, I'm through. Thank you so much.